Okay, Sean, I think we are live now. Let me do with our chat. Okay, so welcome Dr. Parsa and everybody else out there in the lupus community. Thank you for joining us here with office hours for Dr. Parsa. And we wanted to, spend a little bit of time, talking about the latest research and what's going on, especially with COVID-19 and lupus and the lupus community. And one of the things that we've learned here in the last few months or so around, lupus and the COVID-19 is just the importance of making sure we maintain a healthy lifestyle, the right levels of, zinc, vitamin C, vitamin D. We talked about this early in our office hours with Dr. Parsa several months ago. But as the coronavirus pandemic continues, right, as we're still probably 12 months away from a virus. From a vaccine. We're all looking for the day to get back to kind of a new normal. But that's probably another 10 to 12 months until that happens. And so in the meantime, as shelter in place starts to open up, we are still going to, obviously have to practice social distancing, and especially for lupus patients or anyone with a chronic autoimmune disease, making sure that we keep ourselves distant, especially from those that have been diagnosed with the virus or maybe exhibiting the symptoms. But also, what could we do to make sure that we are maintaining a healthy, lifestyle? I think as lupus patients, we're always told to, get rest, exercise, eat healthy, watch, our vitamin D that we talked about. But for most people, getting vitamin D through the sun is their natural means, as well as through diet, of course. But oftentimes, most lupus patients, of course, we're always told to stay out of the sun, right? So vitamin D is always a challenge for lupus patients. And there's more and more research over the past several months since COVID-19 around the importance of maintaining a healthy level of vitamin D in your system to help your immune system, boost your immune system, and so forth. So we thought today, as I mentioned, we had talked about vitamin C, vitamin D, the importance of that, zinc, magnesium, several months ago on office hours with you back in, I believe it was March. And so we want to do a little bit deeper dive. There's been a lot of research since, like I mentioned, since in the last couple months around the importance of vitamin D. And so, so with that, I wanted to, kick it off here with a discussion with you, Dr. Parsa. I know you've got a lot of experience working with thousands of patients around the world, hundreds and hundreds of patients you've been working with around maintaining their levels of vitamin D and so forth. But just to kick it off here, first, again, thank you for joining us here at the Lupus Foundation.
My pleasure.
Really appreciate you spending the time, with us and with our community. And so with that, what is, if you could share with the community here and the viewers on our YouTube channel, what is a healthy level of vitamin D that patients should be watching for when they're doing their lab work, blood work, and so forth? What is a healthy range, a good range to be in?
I'm glad that I'm here, and it's a pleasure, being with our lupus patient here. Vitamin D, as you know, is one of the vitamins that is soluble in the fat. The importance of the vitamin D has been more revealed, since last 10 years. At first, we were thinking about just, like the vitamin D is just responsible for the absorption of the calcium, and it's good for the bone and bone metabolism. Newer studies and within the last 10 years just showed that the vitamin D has a lot of essential role with the immune system, with the mental health, and it's one of the factors with the severity of the chronic disease, including the autoimmune disease. Vitamin D, generally speaking, just would be, there's two ways that it gets to the body. The first is through the diet that we're taking. It goes to the body and absorbed through our GI tract or the intestine and would get into the system. And one of the things about the vitamin D is needed to be metabolized more to more active form. That's what we call it 1,25-dihydroxy vitamin D3, which is the active ingredient of the vitamin D. So the second source of the vitamin D is the sunlight. when we have exposure to the sunlight, the UV, the ultraviolet, the wave of the sunlight would activate the vitamin D2 that is needed to be converted to the D3 and then being more metabolized to the 125 dihydroxy vitamin D3. So it's good to always just, for the people that doesn't have any problem with the skin cancer or the autoimmune disease like lupus, to get, sun exposure, which is good for the vitamin D. And at the same time, it would also activate the pineal gland in the brain, which is responsible for the mood and also the psychological, status of the body. But as we know, that they're not necessarily anyone that get enough of the sun exposure, they're going to have normal vitamin D2. And most probably the reason is the conversion of the D2 to the D3 might be a problem, in the body. The enzymes that are responsible to just taking, effect to just converting the vitamin D2 to D3 might be low, or might be just being overwhelmed by too much of the vitamin D2, not being able to be converted to vitamin D3. So for that reason, and multiple other reasons that we still don't know, the vitamin D deficiency is one of the pandemic in the world for the last decades. In my practice, I've checked almost 500 plus of the patient in the California, which has a good sun exposure. And in my, roughly 90+% of the people, they were either vitamin D deficient or inefficient. And what is the meaning of that one? So the level of the normal level of the vitamin D is between 30 to 100. So if somebody having from the 0 to 10, we call it deficiency, from 0 to 20, we call it deficiency, and between 20 and 30, we call it insufficiency. So 90+% percentage of the people and patients coming randomly for a different reason, including the regular checkup, that I checked their vitamin D, they were either deficient or insufficient. And we still don't know what the cause is, but we know how to treat it. The treatment is, of course, for the lupus patient, I don't recommend to go to the sun, or if they go to the sun, make sure that they have a sunscreen, because what we know is the UV also is responsible for the destruction of the cells, which is making, the inside cell content exposed to the immune system and triggering the activation of the lupus. So one of the things we always wanted the lupus patient to be careful, try to avoid, sun tanning or sun exposure, or if you have to, make sure that you have a good sunscreen to protect your skin. So the only way, especially for the autoimmune disease and lupus patient, is the intake, the amount of the vitamin D we are taking. I was actually checking, the up-to-date website, which is the Bible of the medicine. And unfortunately, I saw that it hasn't been revised, with the vitamin D and how we have to correct it. From the personal experiences that I had with multiple patients, including myself, when I was checking my vitamin D level, it was 29 something, which was the low borderline normal. And I started taking 5,000 of the vitamin D3, which is 5 times higher than the normal recommendation by the up-to-date and the medical references. After 6 months, I checked my vitamin D, and it was 31. Basically, it was almost no significant increase. So I had to boost my, vitamin D to the 50,000 weekly plus the 5,000 daily. And after 6 months, when I checked it, it just jumped up to the 41. And then since then, I've been taking it, and we have to monitor it. For the lupus patient, I will recommend, number one, if you are in contact with your primary care physician and you want to do the annual checkup or the regular checkup, make sure ask them to check the vitamin D level in your blood. That's very, very important. And the reason for that is because based on that number, we can come up with the protocol how to correct and how to just, take care of that low vitamin D. Based on the book, if someone's vitamin D is below 20, we recommend of 8 weeks of the 50,000 along with the daily of the 5,000 vitamin D3. Also, we have to make sure some studies showing somehow the transportation of the vitamin D through the inside the guts to the body would be mediated by the magnesium. And magnesium deficiency or the low magnesium is also another deficiency. One of the reasons that we know is the people who are taking antacid, like omeprazole, pantoprazole, Pepcid, those kind of things, it would affect the magnesium level. So we are not sure if the low vitamin D is solely dependent on the magnesium, or magnesium is one of the factors that doesn't let the vitamin D to be absorbed. Another things that we know is, which is in the body, when you're deficient in something, the body is try to just do everything to maximize the absorption of that element. In the vitamin D is the opposite. When the vitamin D is going low, the absorption is also going lower, which is actually instead of the being a positive, negative feedback, it's a positive feedback. Basically, that means that the body is not able to absorb it. So we have to treat it very aggressively. And based on the book and the recommendation from the scientific communities is that we treat the patients with the 50,000 weekly and 5,000 daily, and check it in 3 months and monitor it until it gets to the normal level. As a reminder, the 30 to 100 is a normal vitamin D. There are some studies in the basic science research, when you looked at it, the vitamin D has, besides helping with the absorption of the calcium and the phosphate and the healthy bone and the muscle, it also is an immunomodulator. What is the immunomodulator? Immunomodulators are chemicals in the body that helps the immune system function properly. The other words is, it's a double-edged sword, that the immune system, if it would be hyperactivated, it would just go attack the self, the body. That's what we call it, autoimmune system. We don't want that happens. It's like a strong policing system. We want to make sure that the security is there in the community, but we don't want any interaction between the normal people and the cops. So the same thing with the immune system. We wanted the immune system working against whatever is attacking our body, which is the viruses, bacteria, funguses, cancers, and that's the role of the vitamin D, the immune system. As you know, even the cancer, which is a little bit more common in the lupus patient, also would be eliminated by the immune system. And there's a group of the cells, we call it NK cell or natural killer cells, that they're very dependent on vitamin D, how precise they do their action. In the low vitamin D level, the natural killer cell, they're not able to go find, target, and destroy the cancer cells. So make a long story short, with all the studies, more than thousands of the studies about the vitamin D, we want to keep the vitamin D at the normal level, and especially for the immunomodulating activity of the vitamin D, we want it above the 50. Unfortunately, it hasn't been written in every single textbook because there are a lot of these are new studies coming out, and I'm sure in the future is going to be published and is going to be updated in our medical references. But just make sure that you're reminding the people might not know the subject, that especially for the autoimmune patients and for the cancer patient, we want to keep the level above the 50 to 65. That's a good range above the 50. I want to get back to a study that we just recently published from the Europe. In the Europe, the most mortality happened in the area of the Spain and the Italy. And when they looked at it, and especially in the African American and Hispanic, I was looking at the numbers in America. 83% of the African American are vitamin D deficient, and 70% of the Hispanic are vitamin D deficient. So no wonder the mortality is so high. And that is study in the Europe and Italy also supporting this, because they found that the people with the very low level of the vitamin D, basically the immune system would be completely out of control. Basically, it's responding, but you cannot stop the immune system at the time that the virus has already been captured. So the body has been harmed by the over and excessive and too much aggression from the immune system. And they saw almost, it's one of the study, of course, we cannot rely on that number, but there was a 99% mortality in the people with the low vitamin D below 10. And I'm not surprised. In my practice, I've seen the people with the low vitamin D, every single winter. They're coming for the pneumonia, sinus infection of all type of, things, and even the cancer is higher. So the vitamin D, I believe after the COVID, we have to focus on it to correct it, in our community. A lot of the food in the Western countries would be enriched with the vitamin D, but, it's not enough. Like they're adding, like 1,000 or 500 units of the vitamin D. That's not sufficient to take care of the low vitamin D deficiency. Bottom line is we have to, number one, to find and target the patients with the vitamin D, which is very common. Ask your primary physician to check it for you. Make sure that if they're started with 1,000 or 2,000, based on the book, they're not making a mistake, but unfortunately it's not being updated. I would highly recommend don't go less than 5,000. And if it's less than 20, your vitamin D, make sure that would be supplemented along with the 50,000 weekly. And then after 3 months, make sure you check your vitamin D level until we get to the level above 50. That is very important for the general health. A lot of studies actually knew, I was reading the other days, that a lot of the heart risk factor, like hypertension, coronary artery disease, heart attacks, and also diabetes, the people with the higher and normal vitamin D has a better control over the sugar. So vitamin D is an essential factors in the body that play roles in many, many things. Generally speaking, for the general well-being, immune system, cancer elimination, and in the COVID system, in the COVID era that we are in now, we definitely wanted to make sure that we have the normal above the 50 for the immunomodulator effect of the vitamin D.
Okay, well, that's great. Well, Sean, thank you. That was a much more than my question and a very thorough answer, and appreciate that. So from a patient point of view, as we're getting our blood work completed, vitamin D levels, what you're recommending and from your experience is somewhere in the 50 range. It sounds like, can be as low as 10, very kind of dangerous range, if you will, as far as a healthy immune system. Recommending somewhere in the 50 range is where we should be at, but it's not that easy. Obviously, we're all different. Our body metabolizes, things differently. Each individual is different, but it sounds like getting up to that 50 may not be that easy. And my next question for you was going to be, what percentage of Americans actually have vitamin D deficiency? And you answered that there a little bit in that previous response where, obviously for lupus patients, there's estimated to be 1.3 million lupus patients, in the United States. 9 out of 10 lupus patients are female, and the majority of patients are non-white. And so those statistics that you just, shared as far as, what percentage of individuals have low vitamin D, 83% African-American having low vitamin D. I think you said 70% Hispanic low vitamin D. Those are really high numbers as far as deficiency, within any given population around vitamin D. So, obviously the higher dosage, I think one of the things that physicians recommend, or most primary care physicians and rheumatologists recommend as far as vitamin D supplements, is somewhere in the 800, 600, 800, per day, up to maybe 4,000. Interesting to hear your experience that you were taking 5,000 a day, higher than the recommended dosage for 6 months, and still didn't get your vitamin D up above 30, then alone, 50. And so I think definitely interesting, just research overall that we're seeing over the past, several months, and most recently around vitamin D. And it feels like there is a significant population out there that, does not have healthy levels of vitamin D, in their system or in their body. So great. Thanks for sharing that. In addition to the supplements, what are you, just from a diet point of view, it's interesting. You had mentioned around, cancer, diabetes, and so forth. As we're all living at home, shelter in place these last few months, it's very easy also from a diet point of view to let our diet slip a little bit. Interesting study around, obviously there's a higher risk of fatalities with folks that have chronic, illnesses like asthma or respiratory, challenges, right, with COVID-19. Obviously, not maintaining a healthy weight, obesity has played into, a higher fatality rate from, research so far, as well as diabetes, right? Those that are diabetic have a higher risk. And it's interesting just the sugar intake and the impact that has on your white blood cells. Your white blood cells really are focused around, fighting off infection, and it's why diabetics have such a higher infection rate. So obviously maintaining a lower, sugar intake, maintaining a healthy diet definitely can help also improve not just the immune system, but also your immune system to fight viruses. With that, what are some things around vitamin D? Speaking of diet, what are some healthy or foods that have high vitamin D that people can also not just supplement, with vitamins and the dosage per day, as you were mentioning, 4,000 to 5,000 or even higher. But what are some natural ways that people can boost their vitamin D through foods?
That's a very good question. We just, generally speaking, I would just, focus on the diet, for just make sure that we're having the healthy diet. If we're deficient, which is very likely there's a more than, again, 50% chance that, someone randomly being picked in the United States having the low vitamin D deficiency. Unfortunately, just, the amount of food that we are taking has limited amount of the vitamin D that doesn't let us to get to the level that we want it to be corrected. For the maintenance, that would be good. The food like, the seafoods, like the fish oils that has the, the natural source and natural source of the vitamin D. But it's good when your vitamin D becomes normalized. Because, in order to get enough vitamin D, then we might need to take a lot of calories along with that vitamin D, which I want to make sure that we are just watching our diet at the same time, make sure we're not, and unfortunately, obesity and being overweight is another problem that, the American population have been dealing with. So what I would just recommend, make sure that you're eating healthy. The percentage of the, like there are 4 different types of the food that we have: proteins, the lipids, and the carbohydrates, and the vitamins that we have to take. So we want to make sure that, the patient just having the balance as far as the percentage of the carb and the lipid they're taking. Make sure that, if you have the options, try to buy the organic one. Try to just, make sure that if it's a non-GMO, and I think that, we have some good stores that you can find the natural, organic, verified, the food that we have to take. But make sure that we have to supplement it. Unfortunately, it's going to be very difficult to troubleshoot the problem of the vitamin D deficiency with the diet. But once it's getting to the normal diet, to the normal range, then normal and healthy, diet would be helping to maintain that vitamin D. And so supplementation is the major one that I will recommend that for the patients to take that. My philosophy about, taking the multivitamins, even there is not much, studies supporting taking multivitamin. And the reason I would tell you, the reason is because the multivitamin is a complex, amount of all the vitamins in one pills. So it's going to be very difficult to know exactly which is which and what it does. So, but what we know is there's some of the vitamins in the body that doesn't have a storage system. So basically we have to take it every day. Otherwise the body would have problem to with the function of that elements, like trace elements. A lot of trace elements that, the studies showing that has major role in our metabolism and our healthy well-being. So my always recommendation to all of my patients, and I'm actually doing it the same for myself, is I always take a good multivitamin for the sake of, those trace elements that might not be in my diet in one day, and we don't have enough storage in our system to be taken. So make sure that you find a good natural source of the vitamin, multivitamin with the trace element in it. And on top of that, make sure that you're taking check your vitamin D level, and then make sure that you get the supplementation until we would be able to get to the level we wanted to. Don't stop when your vitamin D become normalized to 30, 35, as we talked. That is good for the absorption of the calcium and the bone and the muscle health, but it's not good for the immune system. The function of the immune system start at the dosage of the 50 and above. So make sure that before you get into the level of the 50, just work with your primary physician and whoever is taking care of your health to just, give you the supplementation. And as you know, the 50,000 weekly is a prescription dosage, which you need to ask if your level is really low and then you want to bring it up. That's very, very important. With the diet, we wouldn't be able to get to the normal level of the vitamin D. As you know, the United States and the Western countries enriching a lot of, foods with the vitamin D, but we still seeing that, again, 83% of African Americans, 70% of the Hispanic, and more than 50% of American have the vitamin D deficiency. So what it says is the level that we are taking, because of the mechanism that we still don't know what the mechanism is, the vitamin D is low. Our job is to bring it close to the 50 and above, and then maintaining it with the healthy diet. Diet is very important, as we know, for the general health, for the health of the body, mind. As you mentioned earlier, just make sure that you get enough sleep. Sleeping is the time, especially during the REM, rapid eye movement, the body would start, healing itself. Basically, the areas that has some toxin being accumulated would be detoxified by the body. The body is taken care of and being well maintained, during the sleeping. So make sure you get a good sleep, have a good environment, positive attitude, exercise, and especially for the lupus patient, do not go for the outside for the sun tanning or sun exposure. Make sure always you have the sunscreen, SPF above 90 and above, and then make sure that enrich your vitamin D with the supplementation. Again, depends on the level. We can come up with the protocol, what would be the best working for the patient. But generally speaking, taking 5,000 a day is not going to cause any harm unless somebody's vitamin D is very, very high. Among all the patients I've seen since last 12 years, there was just one patient I saw that the level was in the high normal. And that's the only patient I saw. I believe that's the best way to just go. So number one, know how low is your vitamin D. Make sure that you maintain it with the good food, organic food, healthy food. Make sure you watch the calorie. We know that being overweight and being obese is a risk factor for vitamin D deficiency. Smokers has also higher, level of the vitamin D deficiency. Air pollution is another one. I believe the mechanism behind is the UV wouldn't get through, the pollution would be weakened, as passed through the layers of the air until to get to the skin. So there are multiple factors, and I believe that personally, without having any evidences, there is some problems with our enzymes in our body for the conversion of the vitamin D, that we're not able to have enough of the active form of the vitamin D, which is the 125 dihydroxy D3, which is doing all the immune system job and the job for the bone and the muscle health. So we have to get to that level through the supplementation. At the same time, we have to make sure if you're obese or overweight, watch our calorie, get a consultation with the weight loss clinics with the right diet, and make sure that we're doing the exercise, cardio, supplement with a good multivitamins, organic one, and also supplement the magnesium while you're taking the vitamin D. Magnesium, I will recommend to take it nightly. Some people might have some problem with as far as, like some diarrhea with the magnesium. Magnesium chloride is the one that doesn't cause diarrhea. But if someone has problem with the constipation, I believe the magnesium is killing two birds, helping with the normal bowel movement. At the same time, it's helping the absorption of the vitamin D through the body and through the GI system.
Very interesting. Okay, that's great. Well, thank you, Dr. Parsa. I know we're coming up on our half hour here, but let me just recap a couple things. So, what is a healthy level of vitamin D? Recommendation here is, try to get up near 50 or above, right, is really when it starts to have a positive impact, on your immune system. Very interesting to hear such a high level of Americans that do have a vitamin D deficiency. More than 50% is what you had mentioned, but even in certain, races and communities and so forth, like African-American community and the Hispanic community, it's 70 to 80% have vitamin D deficiency. Second thing is then, if you do have vitamin D deficiency, once you have your blood work done, Supplements, definitely use supplements to get you up to that healthy level, and then diet to maintain that healthy level. High vitamin D diet foods such as, salmon, cod liver oil, canned tuna, mackerel, sardines, egg yolks, I know are another great, supplement or another great source of vitamin D. A lot of us, eat egg whites these days. If we have high cholesterol, that won't help. It's the egg yolk, right? Obviously, that has the rich vitamin D to help maintain that level once we get up to that point. And then again, as you mentioned, obviously consult with your primary care physician. Make sure you're monitoring your vitamin D through regular blood work. It sounds like maybe don't do it yearly. I know my wife who has lupus. It's blood work like every 6 months. I think maybe every 3 to 6 months. Monitor what you're doing and how your diet's doing, and is that moving your vitamin D up closer to that 50 or above to your recommendation. So that's great to hear. Thank you for sharing all of your wonderful insights, not just from your medical experience, but also your personal experience as well in raising your own vitamin D level. So yeah, thank you for sharing that. Hey, for the broader community out there, again, just up behind me here, you can see our resources. You can always reach out to us at communications@lfnc.org. You can also find resources on our webpage there at lfnc.org/COVID-19 for the latest, research and updates. One of the things we always hear is, Plaquenil and the availability of Plaquenil. We're maintaining our webpage of those pharmacies and online pharmacies that have availability of Plaquenil. We believe everyone, that we have up there still has it, but that changes daily. So please visit, our website there at /COVID-19. And so with that, Dr. Parsa, thank you again for another fantastic office hours for our lupus community patients, for the Lupus Foundation, and look forward to seeing you and everybody else 2 weeks from now when we do our next office visit 2 weeks from now, Saturday at 10 a.m. So with that, we'll sign off. Thanks again, Dr. Parsa. Have a wonderful weekend, and a wonderful weekend also to our viewers out there as well. Thank you.
Stay safe, and thank you. My pleasure.